Soluble urokinase-type plasminogen activator receptor is a reliable marker of infection in acute kidney injury. In intensive care unit patients, the acute kidney injury is a common complication, and mostly it is caused by sepsis. Many studies have shown that the systemic concentration of soluble urokinase-type plasminogen activator receptor is high in infections and in critically ill patients when compared to healthy individuals. Contrastingly, a systematic review suggested that soluble urokinase-type plasminogen activator receptor value was low in critically ill patients with sepsis. However, the role of soluble urokinase-type plasminogen activator receptor in critically ill patients with acute kidney injury is unknown. The objective of the study was to evaluate the relationship between soluble urokinase-type plasminogen activator receptor and C-reactive protein, and compare their efficacy as diagnostic markers of infections in acute kidney injury. Critically ill patients, aged greater than or equal to 18 years, with acute kidney injury stage 2 or 3, were eligible for the study. Patients who had the record of the lowest serum creatinine in the preceding 12 months prior to hospitalization was selected for the study. Patients who had acute kidney injury of stage 2 or 3 for more than 36 hours, pre-existing dialysis, dependent renal failure, a predicted life expectancy less than 48 hours, or subjects in whom serial blood sampling was not desirable, were excluded from the study. The sample size of the prospective observational study was 55. Out of 55 patients, 43 were continuous renal replacement therapy. The serial systemic soluble urokinase-type plasminogen activator receptor and C-reactive protein concentrations were measured for 6 days and compared. The area under curve was also calculated. The values of soluble urokinase-type plasminogen activator receptor were significantly higher in patients with an infection across all the time points. Unlike soluble urokinase-type plasminogen activator receptor, the C-reactive protein results were not significantly different in individuals with and without infection. Thus, we can conclude that soluble urokinase-type plasminogen activator receptor had stronger association with the development of an infection. In patients with an infection, the respective area under the curve of soluble urokinase-type plasminogen activator receptor were higher than those of C-reactive protein values on the day of infection. Based on the results, soluble urokinase-type plasminogen activator receptor has emerged as a better biomarker of infection in acute kidney injury patients in comparison to C-reactive protein.